The Pallium project has evolved into one of Canada's most robust examples of a community of practice. COPs are collaborations of people who share specific interests and practices and work together to advance their specific area of practice. A COP reflects a long tradition of working together in Canada among neighbors and within communities to share resources, energies, and efforts in mutual interdependence of common goals. It reflects a great paradox of our times. The simple idea of diligently working together to reframe the complicated question of how can we afford to provide services to an aging population into one which enables us to navigate the complexity of ensuring that systems of care are available when patients and families need them. In this report back to stakeholders, several collaborators in project activities share insights about the project's work, results to date, and the difference it is making.
You don't just plant seeds in a medium and expect it to grow. You have to fertilize it. You have to nurture it. And without Health Canada, I do not think that we would have had a chance to develop the kinds of ideas into implementable projects.
What I've witnessed and appreciated about Pallium is the fact that it came and it was something that was new and everybody was wondering, what is this project and what is it going to do? And what I have been privileged to witness is the fact that, yes, it came with an injection of money to do things that we needed to have done, but it also, along with that money, it came with the expertise and leadership of how to make the maximum or optimal use of that money.
It's almost like the time was ripe. There was certain individuals that were making a difference in their own organizations. There was a push from a variety of places. Money always helps.
I think it's had a wider scope than I thought that it would at the start, which is really exciting. Certainly it's a project that's thought outside the box from the start.
For us to undertake something like this ourselves, it would never happen. We just don't have it. We don't have the expertise, we don't have the time, we don't have the resources. So we need these projects to move it and to move it forward, and it is.
Rurally, we were really struggling and continue to struggle because of distance, lack of formally educated staff, lack of developed teams, and even our social workers don't have a lot of palliative knowledge / bereavement knowledge.
I think that we're trying to push primary health care reform across the country. We're trying to talk about education of professionals. We try to talk about the interdisciplinary model. Pallium has used our model of norms practice really well within what they do.
When we started, the idea of interprofessional education was still an idea. It wasn't really a process yet. Whereas now I think there is a process in that. It is surprising at how quickly things have moved forward. And I really do think that Pallium was helpful in getting that going.
I think Pallium's made a huge contribution to advancing hospice palliative care in this country. One of the issues that we've had is one of attention. That we've done a good job of starting to talk about hospice palliative care in various settings. We've pushed the envelope, so to speak, outside of those just working in hospice palliative care.
They've been a wonderful resource to rural areas for sure, and wonderful for the networking coordinators as well, because it certainly has given us tools to go out into our rural areas.
I think one of the biggest differences Pallium has made is to provide a mechanism by which the knowledge and expertise that is often quite tightly held in the big centers can be spread to the rural areas or the peripheral areas in the province where people are still dying, people still have the right to expertise in end-of-life care, but there have been challenges and barriers to get that expertise.
Pallium has taken off very quickly. And you know why? I think it's because it is not a concept that grew out of one person's head. I think it's a concept that might have started in Dr. Priera's head, in Michael Ahern's head, in several others. But once it was shared, and once it was facilitated by resources made available by the federal government, and a lot of hands made the work light indeed, it no longer belonged to a small group of people. Pallium now belongs to everybody, and I think that is the reason for why its ascendancy and its diffusion, its acceptance has been just spectacular.